Reproductive genetic screening means examining an individual's specific chromosomes or genes for any abnormalities linked to genetic diseases. Reproductive genetic testing enables people to make informed choices about getting pregnant at any stage, before conception, throughout IVF procedures, while a pregnancy is already underway, or when a couple wants to understand pregnancy losses or repeated miscarriages. This can select the one embryo that is most likely to result in a viable pregnancy and reveal genetic disorders that could affect the subsequent generation. Reproductive genetics can help improve the chances of having a successful pregnancy in the following ways. Assessment of the recipient's womb. Parental assessment. Embryo assessment. Assessment of fertilized egg, embryo, or fetus. Newborn assessment and screening. Types of reproductive genetic screening. Reproductive genetic screening is of 3 types. Preconception genetic screening. Preconception genetic screening, also known as carrier screening, is a testing procedure carried out either before conception or during pregnancy to determine whether a person is a carrier of a particular genetic disorder. Despite being generally healthy and often without a family history of a genetic condition, carriers are more likely to give birth to a child who will be affected. Prenatal genetic screening. Prenatal genetic screening is a testing procedure to notify prospective parents whether their fetus has a particular genetic condition. This test is carried out in 2 steps. Non-invasive screening tests look for indications that a fetus is at risk for particular genetic diseases or birth abnormalities. If screenings indicate risk, invasive diagnostic testing is done to confirm or rule out the risk. Genetic screening during IVF. The evaluation of a fertilized embryo's cell's genetic makeup occurs during genetic screening during in vitro fertilization or IVF. Genetic testing is an essential yet challenging step in an IVF therapy that ensures the delivery of a healthy, normal child. Most women over 35 who are undergoing an IVF cycle are recommended to do this. Other indications for this test include a history of repeated IVF failures, family history of genetic issues, miscarriages, or the birth of children with genetic abnormalities in the past. Let's understand one by one about each of the type. Preconception genetic screening aims to provide individuals and couples with valuable information about their genetic health before they conceive. Preconception counseling is a process where couples meet with a qualified genetic counselor or healthcare professional to discuss their reproductive plans and assess potential genetic risks. It involves a comprehensive evaluation of their family medical history, genetic risks, and the potential impact on their future children. Genetic counseling, making informed decisions about a prospective parent's testing options, is assisted by the genetic counseling process in relation to family planning, genetic testing, and diagnostic testing. Preconception genetic counseling. What happens during a preconception counseling appointment? During a preconception counseling appointment, couples can expect the following. Review of medical and family history. The genetic counselor will ask detailed questions about the couple's medical history, including any chronic illnesses, genetic conditions, or birth defects within the family. This information helps identify potential genetic risks that may impact their future children. Assessment of genetic risks. The genetic counselor will evaluate the couple's risk of carrying genetic disorders based on their family history and ethnicity. This assessment helps determine the need for further testing or genetic screening. Genetic carrier testing. Based on the assessment, the genetic counselor may recommend specific genetic tests for one or both partners. These tests can identify carriers of certain genetic conditions, assess the risk of passing them on to offspring, and guide future reproductive choices. Education and information. The genetic counselor will provide education about genetics, inheritance patterns, and the potential risks associated with certain genetic conditions. Couples will gain a better understanding of the implications and options available to them. A genetic carrier test enables prospective parents to learn about the risk of passing on 2 defective gene copies, one from each parent to their future child who will be affected by a disease. Genetic carriers are people who have 1 copy of a defective gene but normally do not show symptoms. The following are some common causes for genetic counseling. Chromosomal or congenital abnormality history in the family. Advanced maternal age where the patient is at least 35 years old. Unexpected blood results during the present pregnancy. Results of an ultrasound revealing a congenital anomaly or a genetic marker. Individual choice to undergo a genetic disease carrier test or screening to determine the probability of the child developing a genetic problem. An abnormal pregnancy in the past. Non-invasive prenatal testing, NIPT. The NIPT method offers a less invasive and safer approach to detecting fetal chromosomal abnormalities and genetic disorders during pregnancy. NIPT methods analyze the fetal DNA circulating in the mother's blood. The test can detect chromosomal abnormalities such as Down syndrome, Edwards syndrome, and Pator syndrome, as well as certain other genetic disorders. Non-invasive prenatal genetic screening. 1. A personal risk assessment for particular medical disorders is provided through a screening test during pregnancy. 2. Blood tests and ultrasound are commonly available genetic screening techniques and they carry no danger to a pregnancy. 3. A negative, normal, screening result indicates that the parent's chance of having a child with a particular medical condition is reduced, but it does not ensure a safe pregnancy. 4. Diagnostic testing for extra information is advised if a screening test for the parent shows a positive, abnormal result. Prenatal genetic testing. Diagnostic tests are used to confirm a diagnosis of chromosomal abnormalities or genetic disorders. These tests are usually conducted during the 2nd trimester of pregnancy. Amniocentesis. This test involves taking a small sample of amniotic fluid from around the fetus and analyzing the fetal cells to check for chromosomal abnormalities or genetic disorders. Chorionic villus sampling, CVS. This test involves taking a small sample of tissue from the placenta and analyzing the fetal cells to check for chromosomal abnormalities or genetic disorders. Genetic screening during IVF. It is recommended to do genetic testing on the fertilized embryos before transferring them to the uterus during an IVF cycle. During an IVF cycle, 5 important types of genetic tests are advised. 1. PGT-A, that is pre-implantation genetic testing, aneuploidy. 2. PGT-M, that is pre-implantation genetic testing, monogenic. 3. PGT-SR, that is pre-implantation genetic testing, structural rearrangement. 4. ERA, that is endometrial receptivity analysis. 5. Miscarriage screening, that is product of conception genetic tests via CMAWESCES. PGT-A or pre-implantation genetic testing, aneuploidy. A genetic test used to look for aneuploidy or numerical chromosomal abnormalities in embryos. Before being implanted into the uterus, embryos undergo this examination. It is possible to identify embryos free of chromosomal aneuploidy for selective transfer by analyzing every embryo created during an IVF treatment cycle. As a result, the miscarriage rates have declined while the pregnancy rates per transfer are rising. PGT-M or pre-implantation genetic testing, monogenic. It includes screening embryos for particular monogenic diseases such as thalassemia, hemophilia, and some forms of muscular dystrophy. Having an unaffected child is beneficial for couples with a family history of these illnesses or for those who have already had a child who was affected. Every embryo developed through assisted reproductive technology is examined for this particular monogenic disease. For a child to be born disease-free, only unaffected or healthy embryos are transplanted. To increase success rates even further, this can be used in combination with PGT-A. PGT-SR or pre-implantation genetic testing, structural rearrangement. People with chromosomal rearrangements, which are the structures that hold our genetic material, is not of normal size or arrangement, are tested with PGT-SR or pre-implantation genetic testing, structural rearrangement. These individuals run the risk of developing embryos with an imbalanced chromosome structure. These unviable embryos can cause multiple miscarriages. PGT-SR can help in the selection of healthy embryos for transfer by screening embryos for such specific rearrangements. Endometrial receptivity analysis. It is a genetic test that identifies the best day to transfer the embryo during an IVF cycle. The doctor performs a mock embryo transfer cycle before your IVF or frozen embryo transfer or FET cycle to get an endometrial biopsy. A small sample of a woman's endometrial lining is taken and sent to a lab for molecular analysis in order to decide when to try embryo implantation in a subsequent transfer cycle. Testing for chromosomal abnormalities after miscarriage. Miscarriage screening is recommended for couples with recurrent pregnancy loss, which is defined as having undergone 2 or more miscarriages. The majority of miscarriages are attributed to chromosomal abnormalities. Therefore, testing the product of conception, POC, typically confirms the genetic cause of the miscarriage. If you have experienced multiple miscarriages, testing the POC can not only help you understand the reasons but also provide actionable information to enhance the chances of future pregnancies. The POC refers to the product of the union between the egg and the sperm. POC sample can be obtained from 8 weeks of pregnancy. When POCs are examined, it is estimated that 60% of early pregnancy losses are associated with chromosomal abnormalities. If you have had multiple miscarriages, testing the POC may not only help you understand why but also provides actionable information to improve the chance of future pregnancies. Genetic testing techniques for diagnosing chromosomal causes for fetal death, miscarriage include karyotyping. A karyotyping is a genetic testing method that analyzes the number and structure of chromosomes to identify aneuploidies, abnormalities in chromosome number, and large-scale chromosomal structural abnormalities in the products of conception after a miscarriage. Chromosomal microarray, CMA. A chromosomal microarray, CMA, is a genetic testing technique that detects small deletions or duplications of genetic material, known as copy number variations, CNVS, in the products of conception to identify potential genetic causes of miscarriage. Clinical exome sequencing, CES. A genetic testing approach that examines the protein coding regions of the genome, known as exons, to identify variations in genes that may be linked to miscarriage or other genetic disorders. It can be used to identify potential genetic causes of miscarriage in the products of conception. CES is subset of whole exome sequencing, WES. Whole exome sequencing, WES. A comprehensive genetic testing approach that examines the entire protein coding portion of the genome to identify potential genetic factors contributing to miscarriage in the products of conception.